I've already made a video for the general public on the benefits of acupuncture or dry needling or fenestration or tenotomy, and that'll be linked to in the description, and it'll be perhaps useful for health professionals as well. And I think all health professionals who can should be using needles. Now, this video is focusing specifically on chiropractors and how to get into using needles, how to get into acupuncture, how to get into dry needling. Now, I wish there was more of a distinction between using needles for tendinopathy and muscle pain, and then on the other hand, using needles in the traditional Chinese medicine sense, the TCM sense, with the TCM diagnosis, talking about the meridians, qi, blood stagnation, and all of those acupuncture points. And I think should be a distinction between the two. But sadly, in terms of the rules, they're often treated the same. So even if you want to use needles for tendons and to do tenotomy for tendinopathy, you may have to be certified in acupuncture, even if you don't want to do acupuncture in the traditional sense. The research supporting dry needling is, I would say, fairly strong. Now, for acupuncture, I feel the results aren't quite so clear-cut that there's a benefit, particularly if you look at acupuncture versus sham acupuncture. But it is true that if you take a meta-analysis, it seems like there is a benefit to acupuncture as well. Honestly, also in my opinion, if you're managing tendinopathies, you should be using diagnostic ultrasound and you should be doing dry needling. And if you're not doing those two things, frankly, it's almost malpractice because of how useful and effective they both are. Now, I will mention I teach diagnostic ultrasound, so you might think I'm biased, but I'm not biased. I started teaching the courses because I was like, this has got to get out there. This has got to get out there. And it is making its way into chiropractic schools. It's making its way into medical schools. It's making its way into physiotherapy schools because the machines are getting cheaper and cheaper. And it should basically be a requirement because of how useful it is. And the combination of the two, the ultrasound can let you know exactly where you need to put the needles. Now, first, not all states allow for chiropractors to use needles. For example, the Oregon Acupuncture Association lobbied real hard, so they're the only ones that can use acupuncture needles. So not chiropractors, not physiotherapists, not naturopaths, only them. Now, I'm not sure about physiotherapists in Oregon, but chiropractors with additional training can inject and perform minor surgery. Same for naturopaths and medical doctors. And using an acupuncture needle is a heck of a lot easier than performing surgery. The Acupuncture Association, I think, is making these lobbyist groups are making the world a worse place. Everyone's just should be able to do as much as they can reasonably to help patients. I'm also negative against physiotherapy associations trying to keep chiropractors from doing exercises with patients, and chiropractic associations trying to keep physiotherapists from doing joint mobilizations. Look, if you've received enough training in it, you have the anatomy knowledge, and if it's going to help the patient, we should all be trying our best to help the patients. Sorry for my little spiel there. Now, if we look at the list of state rules, which will be linked to in the description, some states allow for chiropractors to do dry needling already, but not acupuncture. Even if chiropractors can do acupuncture with or without the NBCE exam, there may be extra conditions, like you must call it meridian-based needle therapy, or in the case of Texas, it has to be connected to neuromusculoskeletal pain. Sure, you can add acupuncture points to treat the whole person, that's allowed, but you can't just do an acupuncture session to improve their fertility or for their mood. The most common requirement is 100 hours of training and writing the NBCE acupuncture exam. Personally, I just wanted to do dry needling, but the NBCE exam has virtually nothing about dry needling on the exam, except arguably the needle safety questions. Some states require 250 or 300 hours of training. Some states don't require the NBCE exam, so check your state requirements. Once you've met the requirements, it doesn't stop there. In Texas, there are continuing education requirements specifically for those who perform acupuncture and/or dry needling. For me in Texas to do dry needling, I had to do the 100 hours of training and the NBCE exam, which meant I had to memorize every single freaking acupuncture point. It will ask, where's the location of this acupuncture point? Right? It will ask, with this condition, what combination of acupuncture points are correct for this pathology. These are things you have to memorize to pass that test. I had to understand the relationship between the elements in traditional Chinese medicine. I needed to know how to make a traditional Chinese medicine diagnosis. And if you're just using needles for tendinopathy, this is sort of a waste of brain space, unless you choose to do traditional Chinese medicine acupuncture as well, unless you intend to use the acupuncture points. Now, I took the ChiroCredits 104-hour program, and it did well prepare me for the exam, but I had to study really, really hard. There's a lot of acupuncture points. The course really doesn't cover the safety stuff, except they said, know this PDF of safety stuff. So if I had to prepare for the test again, I would have actually studied that PDF more, both for its universal usefulness and that I had trouble with those questions on the exam. But the course and my studies really focused on the meridians and the acupuncture points, because the majority of the exam is on those acupuncture points, and I was really struggling to memorize them. And I'll say it again, the chiropractic program is great, and it's really focused on those acupuncture points. In addition to that, I would study the safety stuff a little bit more if you want to be extra prepared for that NBCE exam. So now that you can use needles, what now? Well, there's research supporting needles for myofascial trigger points and tendinopathies, so start there. In my own experimentation, I found that needles weren't as effective in the shoulders, but more effective for the arms and legs. And that's compared with ischemic compression for myofascial trigger points. But even in the shoulders, I still sometimes use them. For example, I would needle one side, and then I would do ischemic compression on the other side, making use of my time. Ischemic compression is slow and painful. Needles are painless, and you can do many points all over the body at once. They work great for muscle tension too. Those ropey paraspinals that are painful to massage and rarely relax much? Needles, man. Needles. So easy, so effective. Along the ribs, so easy. And those tendinopathies, your tendinosis or tendinitis or enthesitis, needling can work as well as injections. In particular, ultrasound guided is better than anatomy landmark based. I find ultrasound guided awkward to do, right? Because you're holding your unit here, and you have to use special sterile gel, and then you have your needles, and so this has to be in place, and you have to come in at a really steep angle here, so instead of coming straight down like this, it's sort of awkward. So what I prefer to do is, instead of ultrasound guided needling, I guess I do ultrasound informed needling, where I'll take a picture of the region and say, okay, based on the last treatment, these parts of the tendon look healthy, and it still doesn't look healthy here and here and here. And you can tell that with ultrasound. A sickly tendon has increased blood flow, which you can see if you turn on Doppler. It is thickened and hypoechoic. So it's darker. So it's darker and sickly looking. And a healthy tendon is this bright fibrillar appearance. And so you just need to know, okay, I need to get the needle into the parts that are sickly. And you know what? Ultrasound has really improved my palpation skills, because I've found that, so I can see it, okay, that's healthy tendon, that's unhealthy tendon. And then you'll go back with your finger and be like, oh yeah, I can feel that. I can feel that. So it really does improve my palpation skills, in terms of also finding landmarks as well. But anyway, I use it to find what I need, then remove it, clean up the gel, and then now I can jab needles, and I have a whole bunch of needles all close together, whereas if I had the ultrasound unit in the way, I can't do that. So I use ultrasound-informed needling and not ultrasound-guided needling. I think it's basically the same benefit, though. Some argue that the needle wanders a little bit, but that you're also having to go through more tissue, right? So I would argue I do it the best way, but it's up to you. You'll have the option with both. You have an ultrasound unit. Now, needling is particularly effective for recalcitrant tendinosis, a tendinosis that isn't responding, to your typical eccentric exercises. And you can imagine why sometimes there's healthy parts of the tendon that are taking the tension. So all your exercise is going through the healthy fibers, and so those tenocytes are experiencing that tension, but the tenocytes that need to experience that tension in order to get their act together and to produce that good, healthy collagen, your exercises aren't reaching them, whereas the needles can reach them. So it's particularly effective in those cases. Ultrasound is also great for seeing, for example, tears instead of tendinosis or tendonitis. So, like I used to hate being like, well, you have pain, no major injury, probably tendonitis. We'll put you straight onto, again, tendonitis. I now know tendonitis should be called, or lateral epigondylitis should be called a tendinosis and not a tendonitis. So it's a tendinosis, but okay, do I want to get them straight into these heavy duty eccentric exercises, or how do I know there's no tear? These weakened, sickly tendons are more prone to tearing. They're weaker. So with ultrasound, you can quickly take a look and be like, okay, there's definitely no major tears. We can go straight into exercises. Or you can look and be like, okay, yeah, it's like half torn. Let's not go straight into heavy duty eccentric exercises. Let's go straight into the needling, straight into the red light therapy. And let's wait till this thing heals a little bit and the fibers start to come together. And with ultrasound, you can see the fibers come together week after week. You can see it happen. It's great. And you can see scar tissue as well. I remember one case of knee pain, some of the worst osteoarthritis I've ever seen. If anyone's knee pain was osteoarthritis related, it had to be this woman. But when I imaged directly over her chief complaint region, I saw scar tissue, which was just disorganized tissue. I was like, huh. So I did cross-fiction, and the scar tissue looked better right afterwards. And then she went and she did her downward dog, and her knee pain was keeping her from doing yoga. She did all her yoga moves, and she's like, oh, it works. No pain, no pain. You're a miracle worker. Oh, boy. I'll also mention ultrasound is good for identifying myofascial trigger points, but both for scar tissue and myofascial trigger points, I would argue that maybe ultrasound isn't required the same way I think ultrasound is required or demonstrably superior when combined with needling and managing tendinopathy. Because scar tissue, if you've really deft hands, you can feel fascial adhesions, right? With tissue pulling and tissue glides. And of course, myofascial trigger points are tender and they're nodules, right? So you can feel those. And if the pain starts to drop with pressure, that's more indicative of a myofascial trigger point. Sure, they look like hypoechoic, darkened sections of muscle, and you can see that on ultrasound and on elastography with ultrasound, which measures stiffness of tissue. They stand out, but in my own experience, I can feel them normally. Okay, I know I got a little off track with talking about ultrasound and things, but okay, back to needles. Okay, with needles, you put them in 3 to 10 minutes. For muscles, I give them a little pull and twist every couple minutes. You can feel if the muscles are relaxed because the muscles will grab the needle at first, and then the needle will glide more when the muscles are more relaxed because the muscles won't hold on to them. Needles may result also in this growing pinkish circle of increased blood flow. And it sometimes maxes out at maybe a little over an inch, maybe 2 inches in diameter. And so you can watch the needles actually do their thing. It's sort of cool. And if you're just using a couple of needles, you'll have some downtime. I use this time for patient education. This is your prognosis, this is your home care, these are the exercises. And I also multitask by using red light therapy too. So I hold the red light therapy over the region. Why not? I know some people who throw a couple acupuncture points in. So not just points into the tendon, but they'll look up, okay, what are the acupuncture points for wrist pain? Or what are the acupuncture points for this type of pain or for headaches? And so they'll not only do the muscles and tendons directly, dry needling, they'll do acupuncture as well, just by throwing in a couple of points. For example, there's a website called acupedia.com, and you just put in whatever pathology you want, and it suggests suggests points for you, and then, okay, I'll just throw a couple of those. So I'm again, multitasking, not just doing the needle treatment, the dry needling treatment, but doing a version of an acupuncture as well. Now, technically, to do full, proper, meridian-based therapy, you need a traditional Chinese medicine diagnosis. You treat the whole person. And so that just picking a couple points isn't doing full acupuncture. Now, I worked with an acupuncturist, but if I didn't, and if I had my own clinic, I would choose to offer full acupuncture sessions as long as I wasn't too busy. I think these full acupuncture sessions are fun. They're sort of neat. It's like getting your future read by tarot cards or reading your horoscope. I would, have a proper acupuncture intake form. I would do tongue and pulse diagnosis. I would come up with this traditional Chinese medicine diagnosis. You would do these longer sessions, 30 minutes or 45-minute sessions, 15 minutes on one side, flip them over, maybe 15 minutes on the other side. There's a ton of people out there who love acupuncture sessions. Instead of going to someone else, they might as well come to me. I might as well be the one doing it. I might as well be the person making money. And if you had to do that 100 hours of training, learning all those acupuncture points, I might as well put that knowledge to use and make that money, right? And it's nice too, because if you're just working on one patient, you have these long breaks. In addition to making the money. So these long breaks are nice. I remember the acupuncturist was always in the break room just having a tea, reading things on her phone, reading a book. It was quite nice. Give you time to catch up on your charts, nice and chill. It also works well with juggling multiple patients. I know a lot of chiros will throw on a hot pack, treat another patient, then come back. Acupuncture or dry needling can work like that. I know I said I multitask on one patient. I put the needles in, then I talk, but I'm really, really heavily focused on patient education. But one of the physios I worked with used needles on almost every patient. He kept himself double booked most of the time, and if he wasn't double booked, it gave him time to catch up on his charting. Now, I'll say, I guess there could be a danger in doing traditional acupuncture with appearing, let's say, non-scientific, right? Because we deal with science, we deal with anatomy, and the spleen in anatomy and the spleen in traditional Chinese medicine have wildly different functions. But that's what you can explain to the patient. Okay, what we're going to do, this traditional Chinese medicine diagnosis system, the organs represent a set of bodily functions. So the heart doesn't represent the real heart. The heart represents a collection of things your body does. Same thing with the spleen, same thing with the liver and the kidneys. And it's not the same as the anatomical structure. So you recognize that. So when you give them a traditional Chinese medicine diagnosis, they know you don't think the spleen actually does these things. And the diagnosis is required to get the needle locations, the correct acupuncture points, right? And the needles. Don't cheap out on the cheapest needles. Buy sarin needles. They are the best. Easier for you to use and seem to go in and out of patients easier. Now, the size I have here, it's this 0.25 by 40 millimeters. This is a good starting size, but I'd recommend you getting some smaller, some longer, some thicker. Try maybe the 0.3 thickness and see if you prefer that thickness. Thinner goes into patients easier. Thicker goes where you want it easier. Sometimes a little easier to manipulate as well. So patient preference and also region. You can use short ones if you're using around the wrist, into the fingers, things like that. You'll want longer ones if you're like going deep into the glutes, on someone with a little bit more fat on them. You'll need these big, long needles, and those needles you might want, again, the thicker needles so that they don't veer off and who knows where they go. So I do recommend experimenting, but as I mentioned, this is a good size to start with. Again, not the sarin, so these are cheap Chinese needles, and they're not terrible. I've worked in clinics where all we had were cheap Chinese needles. These ones were actually purchased by accident, which is why I have them at home with me right now. These ones say no tubes. So if you are buying the Chinese ones, make sure you buy ones that have tubes. Don't buy ones which don't include the tubes. You want tubes included. The sarin ones include tubes included. So you need a box of alcohol swabs or some way to sterilize or clean up the area. You need a box of needles, and you would think that's all you need to get started. You do also need to arrange for a sharps container. In those sharps container, typically there's a charge to get them emptied. But these needles are so small. And remember, don't put the packaging into the sharps container. You're only putting the needle into the sharps container. And the needles are so incredibly small. So in the 2 years I worked at the Da Vinci Center, I don't think I filled up that box. I think it already had some needles in it, and in 2 years it wasn't even close to full. They're so small. You can imagine how many of these you need to stack up to fill a container, right? I hope this gets you into dry needling at the very least. In particular for those states like Kansas and Maryland where chiros can already use needles. You have no excuse. Start using needles today. For others, the Chiro Credits program plus the NBCE exam works out to being about $2,300. So consider if that works with your budget. I'll mention my own course again. The cost of getting into diagnostic ultrasound is about 4,000 to 7,000 USD, and that's including the unit plus education. So it's definitely the most affordable imaging option to offer, and it's arguably superior to radiographs if you treat the extremities. My complete program is about $1,000 for the education part. Anyways, cheers. Have a good day.